A quality minute with Cole Beeler. Another mystery disease out of China. Seriously, I cannot do this again. Let's talk about what we know so far and what you should do. Starting late fall, China detected clusters of increased childhood pneumonia presentations in 2 separate provinces that were 500 miles apart. The WHO was made aware mid-October and requested microbiology testing from China. The Chinese reported heterogeneous results in mycoplasma, influenza, RSV, and COVID in these patients that they attributed to lifting of COVID restrictions prior to respiratory viral season. Looking at the data in finer detail, though, the WHO noted an increase in mycoplasma and an earlier than normal increase in other respiratory pathogens, but no evidence of unexpected presentations or syndromes that wouldn't fit with how these bugs normally present. So China promises to watch things closely, whatever. Then we see cases of mycoplasma popping up in Denmark, and the lay media starts calling it this white lung syndrome, and that doesn't sound good, but it's a freaking sweet soundbite. And it gets more media attention, and then people start looking for it more. Then we see clusters in Europe and Asia and even the United States, and I cannot do this again. Didn't we just have a pandemic? Do I need to reopen my bomb shelter? Are my kids going to miss more school? What is going on? Apophenia is the adaptive process the human brain uses to attempt to see patterns when none exist. It's a protective mechanism. If our nose leads us to a plant that smelled funny and we ate it and then we vomited, the operant response based on the prior trauma makes us freak out when we smell that smell again. But this doesn't smell like it did for COVID, at least not right now. We are currently seeing an upsurge in respiratory infections from multiple common pathogens across the country, which coincides with cold weather and is what we would expect with respiratory viral season. Influenza-like illness, driven by multiple viruses and bacteria, is starting to rear its head again. But so what's all this talk with mycoplasma? Well, it's worth discussing because it's interesting. But to start, it's not a virus. It's a super small bacteria without a cell wall that causes more significant disease in children than adults. So take everything I'm saying with a grain of salt. I'm an adult doc, and most of the data we have on this bug is from kids. It's mostly asymptomatic, but usually presents as an upper respiratory infection or a lung infection. If it does cause a lung infection or pneumonia, it is most commonly mild, to the extent that the syndrome is called a walking pneumonia. You're sick, but relatively not limited. But this is where the white lung name came from. It's just a description of the chest x-ray, findings that are consistent with really any pneumonia. It isn't specific for mycoplasma, it's just pneumonia, and not all pneumonias are severe. Mycoplasma can rarely cause some interesting manifestations like hemolysis, brain infection, even skin involvement, but these are rare and not something I'd worry about for the individual patient who trips a positive RVP. Treatment for severe disease is usually azithromycin, but mild to moderate disease is probably self-limiting, and if little Jimmy is sick but looks okay, you probably don't need to test or treat. Azithromycin is not benign, and is one of the most common overused and under-needed antibiotics that I can think of. This recent potential upsurge shouldn't change your testing or prescribing practices, at least not yet. Like any illness, patients should try to isolate until they're feeling better. Asymptomatic spread is possible, but under-described. We use droplet precautions in the hospital, but otherwise there's not a whole lot that we can do to prevent infection, though you may consider post-exposure prophylaxis for people who are profoundly at risk. I don't think this increased surge in mycoplasma is fishy at this juncture. Mycoplasma comes in epidemic waves every few years, and we've had a few quiet years. We are still catching up our population-level immunity to the other pathogens that were quiescent during COVID restrictions and not infecting us and giving us little mini boosters. It's plausible that we will continue to see more of these surges with known common pathogens as our younger generations catch up their immunity libraries. This childhood pneumonia surge seems like it's a typical clustering of cases related to seasonal circulation events instead of a new pathophysiology or etiology. The lay media likes painting a picture of spread, but this seems more coincidental to me at this juncture. We're very tempted to analogize to how COVID felt initially. We've been burnt, but this is not like COVID. The syndrome is generally mild with low mortality, and associated with very treatable pathogens that we have history with or data for. That said, after getting burnt by COVID, we have to be critical of almost everything. There could always be weirdness that develops. We need microbiologic and clinical surveillance that you can help with. If something feels weird to you, test appropriately, isolate aggressively, and discuss with us in infection prevention. We don't know what we don't know. And we have to take weirdness seriously at this point. But everything we know so far about this white lung syndrome seems to be consistent with known variables. Thanks for listening, but special thanks to Drs. Bumbra and Christensen at Riley for putting together the snot tracker. If you're like me, the most common question you get from loved ones is, what do you think I've got, when they're sick? And their weekly viral surveillance newsletter is a quick consult for this that makes me seem smarter than I actually am. See ya.